Hello, and welcome to episode 3 of Skin Biology with Dr. Hephzi Tagoe. I have received all your comments and all your questions, and so next week's episode is dedicated specifically to addressing all the questions you've been sending through, and I'm also going to do practical tips for general healthy skincare routine management. Don't miss it. In this episode, however, we are looking at a condition that is quite chronic in society, and almost everyone would have suffered it at some point in their lifetime. It's not spoken about enough. Acne, every teenager's nemesis. But it doesn't just affect teenagers though. As young people today tend to reach puberty at a much earlier age, we're seeing the incidence of acne appear much younger in the current generation. It can have severe psychological impact on personal self-esteem and confidence and just general well-being really. So it is a condition that we need to highlight a lot more. But it's not all doom and gloom. There are simple management tips we can apply, not just to control acne, but also minimize the scarring that comes along with it. In this episode, we are going skin deep to understand what may be causing your acne and the best way to manage it. Stay tuned. Welcome back. So what is acne and what actually causes it? So usually when we talk about acne, we are referring to facial spots. They can, however, develop in other places as well. Now, there are different types of acne, but the main ones are your blackheads, your whiteheads, the pimples, and your deep cysts. Last week in episode 2, when we looked at the biology of oily skin, I spoke about the sebaceous gland and how it produces skin's natural oils. Now this is actually directly linked to development of acne. Now in episode 1, we also looked at how your skin continues growing new cells all the time, and the old dead skin cells fall off or they shed off the surface of the skin. What happens with acne is that the skin that is being shed off it's not completely removed off the surface, and then you've got the sebum producing the natural oils, which then clogs the skin cells that have not been shed off the surface of the skin, causing a blockage, which can then develop into either a blackhead, a whitehead, or your cyst filled with pus. The actual bacteria that causes acne can be found on everyone's skin surface and is totally harmless. However, some people are more prone to acne than others, and it's mostly because they tend to have more oily skin. And so that combination of your oily skin, dead skin cells that haven't completely fallen off, and the infection from the bacteria then causes your exacerbation of acne and the breakouts that you will be experiencing. There are several other factors that can induce or exacerbate your acne. So obviously there's genetics, and then we also have usually smokers as well tend to suffer more breakouts. Also certain medications, particularly ones towards hormonal correction treatments, can also influence breakouts of acne. Research also suggests that genetics combined with certain hormonal treatments can also increase the rate of breakouts of your acne. If you do suffer from severe acne, just seek medical help at the right time, because early intervention can particularly help prevent scarring. In a little while, we are going to look at some simple tips that can help manage your acne, so stay tuned. Welcome back. So how can we manage our acne? The two main approaches we can take towards the management of acne. You have your topical applications, which is basically using surface creams, and then we have our systemic attack, which is where you're treating acne internally to avoid the external expression. The type of treatment you get for your acne depends on the severity of the condition. Topical treatments include creams containing antibiotics, your retinoids, and also benzoyl peroxide. Now for women, treatment with the combined pill can also help minimize the exacerbation of your acne. And patients with more severe breakouts will need oral antibiotics as well. Of course, there's the issue of antibiotic resistance and sparingly prescribing antibiotics. However, hey, if you need it, you need it, right? That's it for this week's episode of Skin Biology with Dr. Hephzi Tagoe. Thank you for listening, and if you do have any comments or questions, as usual, you can always leave them in the comments below or send it to me privately across any of my social media handles. And for those of you who have my number, by all means, you can send me a message or a WhatsApp directly. You can email me as well. Thanks for watching. I will see you next Thursday for another episode of Skin Biology with Dr. Hephzi Tagoe. See you.